Let's talk more about this with ABC News medical contributor and Chief Innovation Officer at Boston's Children's Hospital, Dr. John Brownstein, as well as best-selling author and professor at Brown University, Emily Oster. Thank you both so much for being here. Dr. Brownstein, let's start with you. We don't know the specific terms of the deal in Chicago, but we do know that it did include COVID testing in schools, new metrics that would trigger schools to go into remote learning, and then also district-wide distribution of KN95 masks. So do you think this is going to be enough?
Yeah, good morning, Kara. Absolutely. I think this far into the pandemic, we have the tools. We know what we need to do to keep our kids in school and to avoid unnecessary quarantines and closures. This absolutely should be enough. We know that testing can be used to, identify students that are infected and isolate them. Test to Stay has been an effective program across this country. And even if rapid tests aren't available, schools do not have to resort to quarantining entire classrooms. I think we know what it takes to identify students, even if they just have symptoms, put those students into remote learning while the majority of students stay in class. Obviously, there's a recommendation around high quality masks, and that's going to be on top of hopefully fixes around ventilation. And of course, vaccination. Vaccination is our key priority here. It's keeping our teachers and our kids safe. So the only part of this that I'm worried about is these remote learning triggers. I'm concerned that, we don't need those at this moment. It's all about more relaxed guidelines around isolation and quarantine. And even though Omicron is more transmissible, I just think that whatever we can do to keep our kids in schools is key right now.
Yeah, and as a parent, again, I'm with you. Anything we can do. And Emily, let's just talk about the shutdown in Chicago for a minute and how it has impacted everyone in the public school system. I mean, we're talking about the teachers, the parents, and the students. What stands out to you the most?
I think that we speak a lot about the idea of lost learning and that students are not in classrooms and they're not able to learn math and learn facts, and that's all very important. I think the other piece that we miss sometimes in that discussion is that school is a safe place for a lot of students. That school is a place where students get a hot meal, they get some stability. This kind of structure is crucial for kids. It's crucial for their families to preserve their intellectual development, their socio-emotional development, to preserve their mental health. So, I think one of the things we've learned a lot over the last year is just how important schools are on so many dimensions. And that is yet another reason why these kinds of closures, the remote learning triggers that we don't exactly know what they are, I think that those are problematic. And I hope that the push here will really end up with kids having consistent quality access to school, which we know that they need.
Yeah, you just hit it. Consistency. Kids need a routine. And Dr. Brownstein, schools across the country, as we have seen, really are handling this all differently. I mean, in New York City, public schools are in their second week of in-person learning. But in Pittsburgh, there's 20 schools there switching to remote learning this week, as well as more than 90 schools in Philly. So do you think there should be a universal threshold of cases that should trigger remote learning, or should school be held in person no matter the case rate?
I don't think so. At this point in the pandemic, we've learned a lot about this virus, and especially around Omicron. I think I absolutely agree with Dr. Oster that, triggers are really problematic. And I think there's very few, situations in which you would want to put a school into a remote learning environment. We know that the risk to kids and teachers, especially if they're vaccinated, is incredibly low. And closing is just not a strategy that we should be enduring right now. That's just not possible. Yes, systematic fixes to our schools, like ventilation, is super important. But at the individual level, if we need masking when, community transmission is high, that's fine. But otherwise, we need to be keeping our kids in school. Obviously, science might change over time, or there's a new variant that emerges that might mean that we need to be flexible. But at this point in time, I just don't think these triggers have shown to be at all valuable and really are just more problematic for our kids.
What do you think, Emily?
I think that one thing that we miss a little bit in this is we have this idea that when the school switches to remote learning, then kids are just completely alone in a room and not interacting. And that's not true. When we move kids to remote learning, they may be a much higher risk of getting COVID than they are in a consistent building. So Eric Adams was saying this in New York last week, that the safest place for our kids from a COVID standpoint, in addition to all the other standpoints, even just from a COVID standpoint, the safest place is in the classroom.
So then, okay, but it's still not happening, right? We're still seeing this disconnect in different schools. Depending on the state, schools are doing different things. So as we deal with that, right, how do we keep our kids moving forward academically, whether they're in class, online, because we don't have consistency yet. So while we wait and hope for that consistency, Emily, how do we keep our kids on track? Because really it does come down to what we do with them at home as well.
Yeah, I mean, I think, schools at this point have a fair amount of resources. The question is how they're going to spend them. I think one thing is one-on-one device opportunities. So kids need a computer if they're going to be in remote learning. I think the other thing is perhaps putting more attention on making sure kids are showing up, not showing up for in-person, but showing up for Zoom. I think one of the things we see particularly more in low-income than higher-income school districts is kids simply not being there, not being on Zoom, and to the extent that school districts can try to ameliorate some of that just loss of kids, even in short term, that's probably a good idea. But this is a challenge we haven't really seemed to have solved, even though we're 2 years into it.
Yeah, I mean, maybe there even should be some sort of buddy system, because you're right, not everybody has a laptop or a device. So maybe there's a way that the school districts can find homes that do have devices and possibly put kids together. Who knows? I mean, you've got an enterprise in a situation like this. And Dr. Brownstein, we've got 141,000 Americans now hospitalized with COVID-19, with more than 1,500 deaths reported every day still. I mean, that number is up over 34% in just the last week, and is close to a record-breaking number of hospitalizations for the nation. So what's your reaction to those numbers as we're moving forward through this and also dealing with Omicron?
This is really concerning. And I think, it highlights the fact that, many people thought, okay, Omicron is less severe, there's lower risk of hospitalization, it won't have the impact on our health systems. And that's just not true. The sheer number of infections, the large, record-breaking numbers of cases, even if proportionally it's smaller, that denominator is so great that we were going to have this impact in our health systems. And that's what we're seeing. I'm in a health system, we're seeing these challenges. And this was on top of a Delta wave that we were already experiencing. And it's not just Omicron, it's staff shortages, it's those that are out because they're isolated. And, this is a problem. And even though there's a debate of whether you've been sort of admitted for COVID or with COVID, the challenge is we still have to use protective gear, isolation. The resources in a resource-constrained environment are really challenging. And that means that it's going to be quality of care that's going to suffer for not only the COVID patients, but the far greater number of patients that need care right now.
Final question, Dr. Brownstein, to you. Later today, Dr. Fauci and Dr. Wolenski will be testifying on Capitol Hill about the nation's response to new variants. We will take it live here on ABC News Live. What are you looking to hear from them?
Of course, we want to see an update on a range of guidance. We know a lot more about this virus 2 years in, and we have a lot more of the tools of testing, therapeutics, vaccines. So wanting to see sort of where CDC stands on a range of guidance. Obviously, there's a discussion around better masking, high quality masks. How will those be, implemented from a distribution perspective? Will every family finally get access to these high quality masks? I hope to see some guidance around isolation. There was so much confusion around duration of isolation and the value of rapid testing. Of course, an update on where those rapid tests are, the half billion tests that hopefully will get distributed, how will families access those tests? And, based on the discussion today, what are the solutions that the CDC is putting out to make sure that we're normalizing in-person learning? What are the tools and the guidances that, districts can use? I think there's a lot that, individuals are waiting to hear from the CDC in terms of how we get through this current surge.
All right, Dr. Brownstein, Emily Oster, I know you both are going to follow our live coverage. Thank you so much. We'll see you after that. Again, want to remind you, you can tune in here. We will carry that hearing live 10 a.m. Eastern time. Thanks, guys, so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.